Past 11 this lovely Tuesday morning. And of course, we are the fresh news people, fresh gist people, fresh entertainment people, fresh dawn people, fresh
Merry people.
Okay, good morning, everyone, and thank you so much for joining us this morning on Health Revolution. My name, as always, is Mary Omeniwo. They call me the Slim Diva, your most adorable.
And I am Judge Dawn Ikoma.
How are you today?
I'm fine.
Okay.
I'm cool.
You're cool. You're doing great.
Yes.
I don't want to talk about the shirt you're wearing today, but let me leave that. You want to see the shirt that Dawn is wearing? You want to see us in the studio? Go to Facebook. We are live at Echo FM 100.7 Owerri. Like, you know how Uche would always tell Clara, it doesn't seem like this whole wahala in the country is affecting you, Clara. And Clara will be like, what do you mean? It is called, what does she call it? Manure. Is it the Holy Spirit manure? So that's exactly how Dawn always looks.
Hey, God, dude.
No clue. No, I don't even know how to put this now. You will never see her down. She's always smiling. Oh, I mean, what's the secret? Because when I came this morning, J-Boy was all over the place. You could see the irritation in his body. But I've never seen her irritated. It's a good one, though. Any secret? Let's know how to do this.
Hey, God, dude.
With all the challenges in this country. You know they call your side, not they reach your side. Okay, thank you so much for joining us, and thank you so much, Barry Cosmos, for handing over to us this morning. As usual, we'll start off with the update for today. And health experts just yesterday came up to warn the public that sleeping in and living in poorly ventilated rooms and areas that are poorly ventilated may lead to suffocation, carbon monoxide poisoning, and even death. They therefore went on to urge Nigerians to avoid sleeping in enclosed spaces such as containers, shops, or rooms with no or small windows. And then they stated that when a room is not properly ventilated, it leads to buildup of carbon monoxide and low oxygen, which can cause a lot of things like headache, fatigue, shortness of breath, difficulty concentrating, and irritation to the eye, nose, and throat. And in severe cases, suffocation and death. Why? Because people keep re-inhaling carbon monoxide that should go out. Right?
Yeah.
You re-inhale. And that's why people always talk about cross ventilation, allowing air to go into the room and out of the room. But because of I don't know what to say now. I don't know how to put this. Now, the target actually for these health experts are people who sleep in their shops. People who sleep in containers. It's not their fault. It's as a result of the high cost of living. Some people can no longer afford the high rents that they pay in Lagos. Not just Lagos, even here in Owerri. How much is one room apartment? If you know, tell me, send me a message. How much? People can no longer fend for themselves. And then you have a situation where you have a widow with 5 children. She has a shop. Or maybe her shop is a container. After school, she baits the children. They lock up that shop, buy what they want to eat, and go back into that container. And the cycle begins the following day. How are these people surviving? So it's one thing for us to come and say, oh, stop sleeping in such places. Is another thing for us to also, as a government, try to do the right thing. Why are the prices of rent or house rent, why is it on the increase? Why does it keep skyrocketing? I don't know if you get what I'm saying. Now that they've added money to fuel, some landlords and landladies will also increase their rent. What's the link between the increment in fuel and your house? After all, the building is still intact. Nothing has changed, except in cases where maybe the person living there was not careful enough, and then they start to damage a lot of things. I don't know if you get me. But what's the link? That's how heartless some people are. So as a result of this, I want you to know, if you're a landlord or landlady, I want you to know that as a result of your, what's that word now? You no longer care about people around you. As a result of that attitude, a lot of people are now displaced and sleeping in containers, sleeping in shops because they cannot afford rent. And now the doctors are saying it is detrimental to their health. Why? Because they will not be breathing in oxygen properly, and then it will lead to death. When you hear stories, someone suffocated or someone died, you say, hey, yeah, he don't die. May he so rest in peace. Is that how we are going to be living our lives? How inhumane some people are? We'll talk about that maybe some other day. Let's move on to the next update. And then a particular association has come up to warn manufacturers to try as much as possible to reduce sodium in their products. Excessive salt consumption in Nigeria, according to them, is fueling rising cases of hypertension and other cardiovascular diseases. And then this particular group came up to urge food manufacturers to reduce sodium in their food, processed foods, and clearly label sodium content on packaged products. I would not want to go deep into that story, but it's self-explanatory. Like we said the other day, you might say, oh, I don't eat a lot of sodium. I don't eat a lot of salt. But it's a lie. Most of the processed food that you buy is full of salt too. Salt. And then it's before you know it, someone also shared a story yesterday and said he went for checkup. He never knew he was living with high blood pressure. Only for him to get there, and the nurses were staring at him and asking him, how have you been coping? You've never checked your blood pressure for one day. No signs, no symptoms. You've been walking on, how do they say it, fireworks. How have you been living? And then one day, God forbid, you just hear that the man drops dead and is gone, and you're wondering why. So a lot of people have this underlying ailments, hypertension, and a lot of them, they don't even know, and then they still go ahead to eat a lot of highly processed food containing sodium. Please reduce your consumption. We want to use our platform to remind you that sodium is one of the predisposing factors to increasing your blood pressure. Biko, reduce consumption. Okay, and then to the last update this morning before we go over to the topic for today. The Southeast Caucus of the Nigerian Association of Resident Doctors, NARD, has condemned the physical assault on a resident doctor at the Accident and Emergency Department of Chukwuemeka Odumegu Ojukwu University Teaching Hospital in Anambra State. And then they warned that failure to adequately address the incident may trigger coordinated industrial action across the Southeast region. And they said the assault occurred on the 4th of March while the doctor was actively attending to patients during a mass casualty situation. I don't want to go deep. Every now and then you hear stories of how our healthcare workers are being assaulted. Someone loses a patient, maybe in the hospital, and the next thing you go and jack the doctor. You go and jack the nurse. You killed my son, you killed my mother. I don't know if you get me. Forgetting that, yes, they will do their best to some extent. I'm not talking about people, healthcare workers who are in the act of neglecting patients. No. I'm talking about those healthcare workers that go all out to save lives. They sacrifice their time, their families, everything, just to ensure that things move smoothly in the hospitals and that people do not die. And then maybe one thing leads to the other and you have complications. Maybe the person bled profusely before you rush the person to the hospital, and that person gives off the ghost, and you are jacking the doctor on the neck, on his thigh, calling him names and beating him up. That is assault. And if you do not know, you will go to jail for it. We need to change our mentality. That person is gone. Yes, I know it's painful. But rather than assaulting the healthcare workers, why not channel that energy into thinking of what next to do? This is not the first time a doctor will be assaulted. I have heard stories, even one I witnessed, koro with my eye like this. Someone was sent to the hospital. He had a gunshot wound. And then the doctor asked a simple question. Waiting down, what happened to him?
Yeah, so they can start.
Thank you. Can you please show me a report or something? Or go to the police, get a report. Because this is gunshot wound. Before you could say Jack Robinson, the friends of that young man pounced on that doctor. Can't you see he's dying? Do something. rather than reasoning with the doctor. Okay, we don't hear you. I beg, we not get what do they call a police report. What can we do? Mba, they pounced on him. This is one out of many incidents that are recorded in the hospital, and nobody is saying anything about it. So the doctors in Anambra are threatening that they're going to go on strike if the government of Anambra State does not intervene in that situation. Because if they keep quiet, it will continue, and people will begin to manhandle our health workers. Because a lot of health workers that we have left the country. Many of them. So these little ones that we have, please pet them. Don't go all out to beat them up. I beg you in the name of God. Okay, Alpha done. Let's go up over to the topic for today. Help us with the topic.
Electricity supply crisis and its impact in health sector.
Bam. Very straightforward. Now, I know you say, Barry Cosmos and Don talked about electricity supply. We want to add our voices. We want to join the campaign. And it's a call to action, like Barry said. I know you're wondering, what's the link between electricity and health? Just imagine, some people are ignorant, forgetting that if a hospital or a healthcare center does not have electricity, they will be faced with a lot. Thank you. That's the word. You see why I talk about you. Nothing to say again. They are doomed. Of course, doomed. Let's leave it like that. You know? They are doomed. Because there will be situations that will require emergency with electricity supply. And the doctors and nurses will be handicapped. They'll be looking. They won't know what to do. Someone shared a story and told me how her son, I think he was about 7 years old, like 3 years ago, way back then. Her son was playing. You know children. Playing, jumping up and down. He would jump from the table to the chair, from the chair to the table, just jumping, playing nonchalantly. The mom was screaming. The mom talked out for where, but at that stage, it's usually very difficult to control those children. And then the next thing she heard was, BAM! The boy started screaming, shouting. In fact, she did not even know what happened. She didn't know the impact he had. What she saw was just blood. And it was not dropping. It was gushing out. Gushing out from his head. As a mother, she panicked. And the next thing, she lifted this boy straight up. Where? To the hospital. This thing happened, according to her, around 10 p.m.
Oh, my God.
10 p.m. on a weekend, on a Saturday. Getting to the hospital, she met with some of the nurses there. You know, everybody started running helter-skelter. The first thing she noticed, according to her, no light. There was no light in that hospital. And then the nurses had to use, what do they call it, torchlight.
Oh, God.
To suture that particular place that was torn. Torchlight, phone touch. This is one out of many. Have you not heard cases of doctors and surgeons in healthcare centers doing cesarean section without electricity? Most of the time, they could have generator, at the corner.
And they won't know there's no fuel.
And there might not be fuel. And the next thing, they start to run up and down. And then somebody comes in, it's an emergency. Maybe a woman that has been rushed from one maternity that they couldn't handle her case. They rush her up to that hospital. It's an emergency and something must be done at that time. And you see them running helter-skelter, not knowing what to do because of erratic power supply. It's not just business owners that are suffering from this. It's not just individuals. I am suffering from this. Don, I don't know if you're suffering from this. When last did you see light? When last did you have power supply?
In fact, it's nothing to write home about.
Everyone is complaining, not to talk of the hospitals, the healthcare centers where people rush to when they are in danger, especially when it has to do with their health. They go there to get solace. They go there to get treated. And at the end of the day, zero. They use torchlights, use flashlights. There was a report that was done 2 years ago by Punch, one of the reporters of Punch. And then they did that report. In fact, I was moved to tears. Showing how midwives would use torchlight to deliver women of their babies in this country in 2026. I don't even understand. Are we retrogressing? Are we going forward or we are going backwards? What's the problem? What is there that we cannot sort out? Electricity shouldn't even be a problem in 2026. I don't know if you even agree with what I'm saying. It shouldn't be a problem. I don't understand what is going on. Okay, now we say, let's go green, go solar, buy solar panels, do this, do that.
How many people can afford
How
it?
many people can afford it? How many people? Not everybody can afford to buy inverters. Not everybody can afford to buy solar panels. And then someone did a joke. I saw a post the other day, and the person said, what an irony. Imagine you buying solar, getting inverters, and getting solar panels.
Yeah.
Only for you to charge it with electricity. And electricity charges it faster. Is that not an irony?
Hey, God.
You depend on the sun to charge the panels, right?
Yes.
But most of the time, I'm aware that some people use electricity to power
Yes,
some of these
yes,
things, and it
yes.
charges it faster. So what happens when there's no electricity? And then the panels depend solely on the sun for power, right?
Yes.
And then God can punish you that the rain come, rain come fall. Rain come fall that day. No sun.
Everything everything has comma.
I don't understand. Like, it's an irony. So even people saying the solution is everybody should put solar in their houses, everybody should go green. No wahala. Oh. But what happens when you don't have electricity to charge? What happens if the kind of solar you have is not solely dependent on the sun? What do you
See how
do?
important light is.
It is terrible. It is terrible. This is just one out of many experiences I cannot begin to talk about here. Most of the time, people complain, that they don't see blood in the blood banks anymore. How will you see blood? When have you forgotten that they'd have to refrigerate some of these things? They refrigerate it, yes. Because if they do not refrigerate it, it will coagulate and go. Oh, done. It will coagulate and go bad. Coagulate.
Yeah.
Which other word can we use?
Thickened.
It will be thickened. I've seen someone that is worse than me. Thickened. You know? So these are issues. You talk about vaccines that are shipped down to Nigeria to help with the vaccination campaign in the country. Where do you think they store those things?
Fridge.
In refrigerators, in the fridge, so that it doesn't go bad. And then now we don't have power supply. How do you think those vaccines will be effective if they are not properly refrigerated? It's a problem, oh. Very, very big problem. People might feel, it doesn't concern me. God forbid. Until you have an emergency, then you know that it concerns you.
It does.
The so-called big men that we have, any little thing, bam, they've gone outside the country. They've flown them out to, countries that can that have adequate and stable power supply. Fly them out of the shores of the country to get treatment.
Yeah.
God forbid, if the man slumps, where is the first place they are supposed to take him to? To a hospital in Nigeria or a healthcare center, depending on where that incident happened. They will rush him there. Or as a big man, you are in a convoy, you're driving past a rural environment, and God forbid there's an impact, there's an accident. Where do you think is the first place they'll rush you to? Passers-by will take you to their health center.
Of course.
And if that health center has erratic power supply, no infrastructure, nothing, Oga, you go die there. Oh. Not because, it's the truth. When can we now start to face reality? The other day we went for Ojezurobodo at Ata Njamba. I shed tears when I went to their health center. That's what I do now. Any community we go for Ojezurobodo, we take a trip to their health center. And I cried. Why? No power supply. That place is in complete, total disarray. If not for the nurses on standby that we saw that day, I'm like, wait, is this really a health center? And then the woman was lamenting, telling us of how the government provided a solar fridge so that they could store vaccines. And then some unscrupulous elements went there and tried to steal the fridge in this country.
Oh, God.
Imagine if they had succeeded in stealing that solar fridge. I wonder what would have become of that health center.
God.
And then we keep complaining. Vaccination gap is too much. A lot of children are not being vaccinated. How will they be vaccinated when we do not have basic amenities? I don't want to talk about the building now. I don't want to talk about the structure. I am focusing on erratic power supply, deteriorating power supply. That's what we are talking about. If it's not affecting you directly, it is affecting you indirectly.
Yes, so.
Okay, I've said enough. Well, to back up what we were saying this morning, just yesterday we got the report that resident doctors at the University College Hospital Ibadan, Oyo State, have threatened to embark on an indefinite strike if the hospital's management fails to provide a lasting solution to the lingering power crisis in the institution.
Wow.
And then they said they had this electricity problem had reached a tipping point, affecting the quality of care for patients and preventing doctors in training from getting the best out of their residency program.
Yes.
This is just the resident doctor speaking.
Yes.
The main consultants, they've not come out to talk. I wonder what will happen if they now say, it's going to be a total shutdown. UCH Ibadan should be one of the best hospitals in Africa.
Yeah.
Go and do your research. Imagine if one of the best hospitals in Africa is fighting hard to get power supply. Then what happens to the small hospitals around? What an irony. In a country that supplies fuel, supplies crude oil to other neighboring countries, a country like Nigeria, the giant of Africa, cannot care for its citizens health-wise. What are we even? I don't even understand anymore. I don't understand. I don't know what to say. It's really heartbreaking. But we'll keep talking,
Yes.
You see this my mouth. I won't get tired. Don, are you tired?
No, I've not even started.
We'll keep talking. We'll keep shouting. We'll keep preaching until the right things are done. That's how we can achieve it. If we keep quiet and these things continue to happen, we'll keep losing our loved ones. And then the doctors warn that if nothing changed within the next 3 weeks, they will commence on an indefinite industrial action to press home their demands. Now, I want to bring to the fore one of the things that they said. And it's really, really heartbreaking. I'm trying to look for that particular part. Where they said that unfortunately they met with the light provider. I don't know what they call them, IBEDC or something. And then they reached an agreement and they said, that they will settle the bill over 400 million naira. That is another issue. Overbilling. Maybe because it's a hospital. This will just pack bill. Forgetting that, yes, it's a hospital, it's a government facility, but it was set up for a reason. To care for people. Forgetting that if they hike the bill, it will also impact on the patients.
Yes, and the prices they would actually tax
Thank you. These things are simple logic. And then they said the worst part is that these days they ration the light. They give them power supply for only 6 hours in a day. 24 hours, they're getting 6 hours power supply. And then they said they wrote a lot of letters requesting that these things should be reversed, they should change it to at least 8 hours. Imagine us now begging. Begging a country that we pay tax to give us electricity supply for 8 hours. This is getting out of hand. I don't know what else to say, but it is heartbreaking. So we're going to open up the phone lines. Before I go back to the conversation, we'll open up the phone lines. I want to hear from you this morning. What is the situation of the healthcare center in your village? Do they have light? Have you ever visited the healthcare center? Not just the healthcare center. The hospital or clinic that is closest to you, do they have power supply? We forgot to add, I forgot to also tell you the story that at some point, I don't know if it is a hospital in Nasarawa or where some people went to seek the services of a doctor and they were told to contribute money to buy fuel for the gen.
Yes, it's normal. It happens not only in Nasarawa.
Can you
It comes down
imagine?
here, it
Even in
does.
Imo.
Yeah.
So you go to a clinic, you go to a hospital, and they say,
tax you
I bet
for
make
it.
una not vessel. Oh yeah, everybody, 1,000 naira. We need to go and buy fuel for generator.
If not, we'll not attend to you.
Who do us? Oh God, how did we get here? So we want to hear from you this morning. Tell us, what's the situation at the hospital closest to you? Ever experienced any of these things we're talking about? We want to hear from you this morning. The phone lines.
Okay, the phone line to call is 0911 20022 0707 454 1014.
Okay. Alternatively, you can send us a WhatsApp message on 0707 491 3438. 0707 491 3438.
Hello.
Hello, good morning.
Good morning.
Yeah, Mary and
Don.
Alpha. Don, Alpha. God bless you.
Bless you too.
What's
your name?
You are doing a good job.
Thank
you very much.
Happy with your station, but you are doing very well.
Thank you.
Now, I'm not trying to deviate from your health matters.
Your
Okay.
name, please.
I wanted to Chilaka, please, from Warren.
Okay.
Chinaza.
Chilaka.
Okay.
I wanted to reach Cosmos, but it wasn't possible because of the line. I want to ask, what happens to the Orash promise to Gimolite? Because where I live, between Emmanuel College to Naked Road, Boston Street, we have not gotten light more than 30 minutes a day for the past 2 months now. Yesterday it was 5 minutes, during for 10 minutes. And this is honestly speaking, we are tired. The country is in a big mess. I want to hear about Orash as it was promised. Thank you.
Thank you
Thank
very
you.
much.
Thank you so much. We are not spokespersons for Orashi or EEDC, but we don't even know. Who do we even point fingers at? Is it EEDC or Orashi?
All of them join.
Abby? We don't even know.
all
We
of
don't
them.
even know who to point, because we are so confused right now. The whole thing is overwhelming. It is really overwhelming. More calls.
Hello. Hello.
Hello, good morning.
Okay, good morning. Who are we speaking with and where are you calling us from?
You are speaking with somebody like Teddy Nabuo from Ebema or Haji Ebema local government.
You're welcome, Teddy.
Thank you very much.
Mm.
The health center in my community, Obokosha Ebema.
Mm.
When you visit us, you must flog everybody around there.
Oh, for real?
It is a jamboree. It is a jamboree.
Kai.
The health center has never, my community has never, Ebema as a whole, has never seen light for the past 20 years.
Hmm.
And then we have a health center that is being equipped by our local government chairman. It's been equipped. But how, from what you are saying, how do they preserve all these things?
Thank you.
Vaccines and this and that. How do they preserve them? There is, if you talk of light, there is nothing like light. There is nowhere you can get light. And then when people go there, even the immediate last vaccination that was done onto children below 14.
Yes.
It was a mess.
Oh.
It was a mess.
My goodness.
So when you begin to go from community to community, I'm telling you, this issue of light, and then I am from that very place where you know and they are called this Orashi and this and that. It's from my place. And these oil wells are there, running every day. Government, they know what they are doing. They are only troubling themselves. They are not troubling us.
Oh.
Thank you and God bless you.
Thank
God
you
bless
very
you,
much.
Teddy from Ebema. Imagine a child born 20 years ago and up till now, that child hasn't seen, it must have become an adult and hasn't seen light. In the 21st century, 2026. Hell, I don't know what to say anymore. This is really bad. Really, really terrible.
Hello.
Good morning, my daughter.
Hello, good morning. Who are we
yeah,
speaking
hello.
with? And where are you calling us from?
Yeah, also Daitayo Pujesi, Radio Ground. I'm calling from Ohaji Dema, local government.
Okay, you're welcome.
Elder, I salute you.
Doctor, God bless you.
Bless you too. Welcome.
Is that the voice of Don? Is that Don?
Mary and Dawn. Mary.
Okay, Mary and Don. So how are you all?
We're doing
fine.
great. Oh, go ahead, please.
Yeah. A joke you cracked here. I think you were asking your second Don how she coping. She's always happy. The fire is happening in Nigeria. It's not moved. I want to tell you, when we are much younger, when I was studying federal government, at the time they were no longer paying us salary. People were gathered here that playing draft. But there was a particular young man among us from Delta State then. I'm telling you about it. So you see him being happy every time, as if nothing is happening. And we called him one day, boy, tell us, we were all bachelors and young men that time. But I was about 78 of age now. So, boy, tell us your secret. Why are you always happy? He said, because the problems I cannot solve at all.
Oh. Okay.
The problems I cannot solve, I forget them. That's the secret.
Yes.
So, let's come back to our talk. You see, the person I spoke about before me is from Edema. I mean, from Edema. Yes, he's from Edema, from Ohio.
Hello.
Yes, in Imo State.
Okay.
But then, if you come to our place, you pity us.
Okay.
We don't have the right. The one we are having now was given to us by one young man, a businessman from our place. He gave us this life. Even with the one he gave to us, this is not giving us life.
Can you imagine?
You can stay months, no life because of this problem. So, but the surprising thing now is that by the time they start the election now, you see those who come out and begin to promise you that are going to give you life as soon as you go them home. If you can, that is their system. They will work, they will do road for you. They will give you life. If you can flash back, Tinubu promised us before he came in that unless he come into power, there will be no life issue again. Yes, he's going to take care of everything. But look at us in Nigeria. But my people, I don't know when you say let us pray. People say Nigeria prayer. But there's nothing we can do than prayer. That's the situation of find ourselves. Thank you. I remember the big general.
Thank you very much.
Thank you so much, the Radio General. We appreciate you this morning for your calls, and it seems more like my people have flooded our phone lines. Imagine a community that has got oil wells. That should be one of the most developed community in Imo State.
Envied, safe.
We are focusing on Imo. Imagine no lights. Not to talk, I know they have roads. At least I've been to Ohaji Bema. I've not gone to other parts. I don't know how it looks like. Okay? But we are focusing on light. And somehow I couldn't get to their health center to go see things for myself. Just imagine the country we are in. That's why I hate. You see why I hate politics? It gives me headache. You say migraine. Don says it's migraine. It gives me migraine. You know, that's how bad it has gotten. Seriously, I don't even want to go there. Hello.
Good morning.
Good morning.
It's okay. I'm calling from Edema.
Okay. Again.
Hello. My people, hello.
Yes, this I am calling is because it concerns me, it concerns us. We are the people that receive the largest chunk of spend about electricity.
Okay.
Like my brother said earlier, for the past 20 years, I saw light last in the village was during my secondary school time.
Can you imagine?
During my secondary school time. My daughter is now 10 years. My daughter is now 10 years. Not in light, my village. The village my local government comes from, is lucky. Their village light is coming from River State.
Can you imagine?
village life, where my local government is coming from. It's coming from the only country that is that state. That's where their life from. The other community in Kenya life for the past 20 years. Go and verify. Like my brother would say. Go and verify.
Your line is breaking up a little, but I just want to ask you, how is the health center at your community? Is there light? Do you people have power supply?
The health center is in Komat. The village doesn't have light for 20 years. The center that will have light. Where will the...
Oh my
Lights
God.
As I'm saying, if there are still electric poles standing, it's few. Electric poles that don't have that for more than 20 years. To know what will be of the wire on it and the post on it. For more than 20 go and verify.
Okay. No. This is bad.
The health center, unless you want to die.
Your line is really breaking
Yeah,
up.
it is.
Chijoke, so sorry. We struggled to hear all, of what you said.
Oh, we got
But
some.
he said that the health center in his community is in comatose.
Yeah.
Do you know what that means? In fact, it's near
Total
dead.
shutdown.
Near dead. Almost dead and waiting to be resuscitated. And then he says that the community where he lives, or the community close to his community, they get their light from River State.
Can you imagine?
Imagine what is going on. And we keep talking about rebuilding the Imo, rebuilding. How long are we going to rebuild, though? How many years? Biko, let me understand.
Hope
How many
revival.
years?
Don't even know.
So we'll continue to rebuild till the next generation and the next generation after this generation is rebuild. I don't even want to remember how many years is Nigeria again?
66, Abi.
You even remember.
Good morning.
Good morning.
Hello. Mary,
Yes, please. What's your name? Welcome.
Mary, happy New Week.
Thank you. I wish you the same. What's your name?
And this your colleague too there.
Good morning.
This is Mike E. calling you from apartment this morning.
Okay.
Oh, welcome, Mike E.
Yeah. For the topic, understand, I want to comment you the fact. Madam, for you people, I want you to give a bed to you people first. Yeah.
Thank you.
Yeah. So for what you are asking about our distance.
Your health
Wow.
center.
Yes.
Our I think
Oh no, what's going on? Mikey, please change your,
Your network.
position.
hello?
Yes, it's better.
Uh-huh.
Are you hearing me?
It's
Yes,
better.
yes.
It's better.
You said you are not hearing me.
No, we can hear you. We can hear you.
You said that our we do have light.
Yes. We're asking if you have lights, if your health center, the health center at your village.
Yes, our health center have light.
Okay.
Yes. Or that if you like, you can come. Let me go and show you the
Wow. Oh, that's
place.
nice.
So, yeah, it's so beautiful. So we are having like even if maybe your house the light is in now shaking, but it's from better government. So
Okay.
but now we have light.
Where is the health
Yeah,
center
it's
located
light.
again? Where is the health
If
center?
light to come, you have light.
Where is the health center located?
Yes, I'm at Amakwaya.
Oh, Amakoya.
Amakoya na-
Amakoya is
Amakoya
close
na
now.
urban area
Yeah.
now. Mikey, are you from Amakoya? Are you from Amakoya?
Yes, Amakwaya and Apapa is the same.
You are big men. You are
Yeah,
enjoying.
now it's close.
You are enjoying. Thank you. Thank you for calling.
Okay, I'm big man. I'm big man. No problem.
Thank you. Thank you, Mikey. I appreciate
Thank you very
okay?
much.
Okay, and he called in and said that the health center at Amakoya is close to Owerri.
Yeah, it's close.
I'm concerned about the health centers
In the
in those interior
villages.
There are some villages in Imo. I've not even heard the names of those villages. One called the other day. I say is Obo. Hey God, what's the name of that community? All my years in Imo, that was the first time I would hear.
Wow.
Of that community. We want to know about communities like that. Not even the urban areas now. We want to try to see if we can get to know, first of all, of those health centers. Because I know that people are listening.
Yes.
They are listening. They listen to this station. just in case they have forgotten what their job is, or they don't know what to do anymore. They don't know the projects to embark on.
Yeah.
Yes, this is an avenue to open up their eye to know those communities to go to.
Yeah.
Hello?
Hello?
Okay, keep your calls coming in 0911 20022 0707 454 1014.
Hello?
Uh,
Good morning.
Miss Dawn,
Good morning.
right on. My name is Mana Yese.
Okay. You're welcome.
Latan Java.
Okay, you're welcome.
Wana Yueze, hello.
Well, my sister.
Thank you. We were at your health center the other day. I've talked about it already.
Yeah.
Mm.
You talk about what center?
Oh no.
Oh, my God.
So sorry. Sorry about that. And try to call back.
Hello? Hello?
Hello.
Yeah, hello, good morning.
Good morning, our beautiful presenter.
Aw,
You're welcome. So who are we speaking with this morning?
our handsome caller.
This is the voice of Alex. I'm calling you from Odag.
Okay, you're
Where
welcome.
is Odago located, please?
Odag is close to your street there. The
Oh.
next street after your where your radio station
Okay,
is.
that's how they will come and carry me one day. I don't even know.
You're the only one. Oh.
Hey, go ahead, please, Alex. Go ahead.
So, when you talk about health centers, we shouldn't be talking about health centers because we know that those ones doesn't exist. When we are talking about the hospital, you mention health center. Those ones have been forgotten. So if a grown-up man now, maybe your wife will be pregnant, you go and visit her in the health. Your own. Because most of them cannot even perform surgery. You're talking about using torchlight. My own, in my village, they have I even, whenever I enter my village, there will never be any light. But every now and then, they will be bringing beer. I say, okay, how you people seeing this light you are paying for every time? They will be disarmed because they normally give us community days. Yeah. Okay, let me come down to over here so that we will not go far because those ones, my community is forgotten already. In anything concerning electricity.
Wonderful.
Okay, now, let's talk about where I'm living at home now. Home now is in Owerri North. It's not that too far. So now, I will take confirm 4 days, 4 good days. NEPA will not even bring light. What I'll be seeing is flashing. When you hear flashing light, they flash it and go. Flash it and go. Then, after every 1 month pass, they come and bring beer. These people still get mine, though.
I'm telling
Bring
you.
this to us. Things ranging from 20, 15, 25,000 for us to pay for darkness. So now, as an individual, see, I know the shake. If you bring that bill, I will decide. What I normally do is to pay them 2 months. What I normally pay is 2 months. If I select 2 months at a roll, I pay 1. I have told them several times, come and remove my light. I'm no longer interested. Because this thing you are giving me now, if I manage to use this and buy it will sustain me for 1 month. These people are just processing also.
Oh, this is
The fact
terrible.
that when you buy that gen now, we buy fuel now, it will not 4 liters, we just 3 hours.
Just imagine.
Then,
Thank you, Alex.
they
Try
are
to
bringing those
summarize.
bills. That will not pay me. Okay, if you are managing, okay, these people you are giving. If you are, so why you not say that these people are not getting this time? Why are they
Yeah.
giving this? And the training fire and being stoned.
Thank
We are
you,
tired in this country.
Alex, thank you so much for calling. If we begin to talk about households, we begin to talk about shops, offices, we will not live here. That's why we want to focus on health centers because that's what concerns health revolution. Hospitals, health centers. I would appreciate it if nurses and doctors and healthcare workers call in
Yeah.
and tell us what they are passing through. It will be of great benefit to everyone so that we'll know that we are not just coming here to say these things.
Yeah,
Now,
shout.
that doctor in UCH Ibadan went on to say that one of their colleague collapsed in the theater due to heat. Heat and exhaustion. that they were doing, performing a surgery. There was no light. What they were using was torchlights. And then their colleague fainted, started having seizures due to heat and exhaustion. I don't even want to go deep. And he says, how will they bring a patient that is dying to them? And then they'll say, please go back. We cannot do anything. Their oath says, save a life, no matter what happens.
Yeah.
And then they go the extra mile. Kai, what these people suffer, I don't want to say it. It's very good. It's very easy to cast blames.
Yeah, at them.
After all, they are paying them now. It's their work now. They are humans first, though, before that profession. Remember that they also have families at home. When they finish suffering in the hospital, they go back home again to that same erratic power supply. How can we even think properly in this country when things are not working? How? I beg.
Hello?
Hello, good morning.
Good morning. Who are we speaking with this morning?
I'm speaking with Uloma. I'm calling you from, what is it called now? I'm new here.
Okay.
Please don't get me sino. Hello, Uloma. You're welcome, and it's good to hear from you, okay?
Thank you very much. I just want to be sure that this line is the AKFM line.
Yes,
of course it
you're
is.
in the right place.
All right. Thank you very much. God bless you.
And
Bless
you
you
too.
too. Thank you. Uloma wanted to test the waters to be sure that our number will connect, and we appreciate you this morning.
Yes.
Okay, quickly.
Okay.
Before we take more calls.
Erratic power supply at health centers or hospitals in Nigeria can lead to patient care disruptions, e.g., delayed surgeries, compromised ICU care. 2, equipment damage. For example, ventilators, refrigerators for vaccines. Data loss. For example, patient records, lab results. Increased cost, generator fuel and maintenance. Safety risk, darkness during emergency.
Imagine you have an emergency. Maybe you've gone over the counter to buy anti-malaria medication. For instance, you took it for 3 days, Abi. 3 days is the dosage, and it did not work. And then finally, you now have some money, and you decide to rush yourself to the hospital, only for you to get there. Maybe at night, you start to have severe symptoms of strong malaria. And then your people rush you to the hospital. And then you get to that hospital, no light. And the nurse brings her phone torch, trying to look for your vein. Will you be comfortable? Searching for vein to fix, what do they call it? IV.
Yeah.
To put the drip, intravenous this thing, inside your vein. Will you be comfortable? The first thing that will come to your mind is, now wow, may she not go put this thing for the wrong place. So yes. And then you will be uncomfortable. The nurse is uncomfortable. The nurse is sweating profusely. You too, you are sweating profusely.
You even tell them, where do they even put that torchlight for that light to actually reflect?
Thank you.
Inside the mouth.
They put it. Inside their mouth. It's in the mouth. They put the torch.
My God.
So that they will see clearly. Eh?
Oh Jesus.
This is not a laughing matter.
I'm telling you.
Hello.
Hello.
Okay, and we lost that call. Hello. All right. Try to call us back. We're trying to take the last lap of our calls this morning.
Okay.
Messages on WhatsApp.
Good morning, Echo FM. My name is Engineer Caleb. Anybody with conscience cannot work in EEDC. That is why I resigned.
Oh.
Why I resigned.
Kai. And he went on to say, good morning, Echo FM. Please go to the Federal University Teaching Hospital, Owerri. You will cry. They use generator most of the time. See, the situation in our country, especially in the power sector, is an intentional act from heartless cabals. This is coming from Engineer Caleb. Well, to some extent, I don't know if I'm going to concur, but to some extent, it's making a little bit of sense. Because why would you want to overbill people? Why?
And still not give them
and then we keep doling out millions and millions of naira. I know that they said recently they wanted to connect the hospitals off the grid. There was a project for that. Money was released. I'm trying to get my hands on it. But I doubt if that has been done. No funds has been released. Okay. It says that over 300 billion naira was earmarked in 2025 Appropriation Act for the Special Energy Intervention Program of the federal government. But as I speak to you now, March 2026, no funds has been released. 300 billion naira. Where did the money go to? Big question. So, Engineer Caleb, you're in line, no? I agree with you 100%. Okay, let's see if we have more messages on WhatsApp. Yeah, this one says, good morning, Madam Mary and Dawn. I am Sahid, texting from Ihechuwa.
MCC Road.
Okay. I sincerely appreciate you for these programs. Today's own inclusive. I only pray that today's own will yield a positive result. It has to yield results, so it has to. Because if we don't talk about it, they'll feel we are relaxed.
Yes.
That's why we'll keep calling them out.
Hello? Hello? We can't hear you, Derry.
So sorry. Your line is really, really sounding low. Okay, and we lost this. Let's see. We have more messages on WhatsApp. People are already snapping and sending their bills. Barry, get prepared, though. A lot of bills on WhatsApp for you. This one sent her bill and said when she complains, they will tell her she's living in a duplex. God, I beg, oh. Wahala day for this country.
Hello? Hello?
Good morning, beautiful presenter.
Okay, good morning. Where are you calling from and what's your name?
Please, it's Mr. Chijoke calling from my call back.
Okay, you called back again.
Yes. Please, I want to ask a question. They said they are building.
Oh God, your line is bad.
Yes.
So sorry. Hello?
Hello? We lost that too.
Hello? Okay, and I think that's the much we'll be taking on the calls for today. So please, we'll keep talking, like I said, and let the right things be done. Key aspects of power crisis in Nigerian healthcare sector. Let us refresh our minds again before we go. It will impact greatly on services. Frequent long-term blackouts will disrupt essential services like intensive care. Laboratory diagnostics. How will we not be having fake results? When someone draws blood from you, keeps it in the refrigerator, maybe to analyze it later, NEPA can't take light. No light. It's either the blood goes bad and then they discard it
and tell you
to bring your blood, and you start to hold them and say, why they've used your blood for something. It also impacts on a lot of things, maternal and child health. Economic strain. The hospitals will face massive energy bills. UCH Ibadan, as at 2024, said they were charged 400 million naira. Imagine. Not to talk of now, we are in 2026. No light. 400 million. How much are they making from that investment? How much? And then when you hike the bill for the hospital, the patient comes, something that is supposed to cost 20,000, you tell them it's 60,000. How much is their salary? You have infrastructural issues, poor maintenance, vandalism. I told you about the hospital, the health center in Atta. We went to the last time, and the nurse said they wanted to steal their solar fridge. The only, what they call that in Anya Uzo, where did they use serious? The only they wanted to take it out from them. It's really heartbreaking. So solutions would be that the government should try, focus more on renewable energy, solar hybrid systems, and then not just that, they should try as much as they can to improve power supply. Nothing more. Nothing more.
That's what we need.
If we really set out our mind to achieve this, it is achievable.
Yes.
It is. Improve power supply, simple and short. People are suffering. People are crying. Patients are dying. Unavoidable deaths due to negligence on the part of power supply providers. And even the government. We have to go down. Parting words, please.
We're still optimistic that something good can still come out After everything we've said today.
This optimism, it don't grow rich here. I'm
very,
I don't know
very-
how
I'm-
optimistic I should
I
be
am.
optimistic. How long, please? Should we now
In
set
fact,
a time
it
frame?
can happen now. It
Now.
can change now.
If it changes now, hey, if it changes now, that means it's a big miracle, oh. Eh? We should be patient. We should be patient. We should be patient.
Something
We have
good
lost
I'm telling
patience.
you.
Eh? The fattest dog, Abi, how do they say it? Eats the
Eats.
fattest bone.
Yes.
Eh? Or rather, the patient dog eats the fattest bone.
Yeah.
The dog has started dying. Most of the dogs are emaciated due to malnutrition. Let's go. J-Boy, thank you. My name is Mary Omeniwo. They call me the Slim Diva, your most adorable.
And I am Judge Don Akoma.
Up
Thank
next
you.
is the news at noon. Stay tuned.
It's the sound of the city. Echo 100.7.
Echo FM.
Echo FM 100.7, the fresh news people.
It's the sound of the city. Echo 100.7.
This week to help those in need.
If you know that it's God Almighty that created you and created we Nigerians like you need to do good things for us because the masses are suffering. How you can suspend me here? Are we your slaves?
And I'm going to win this election.
That is the truth.
Stay informed with Echo FM 100.7. Join us for exclusive interviews with experts, breaking updates on local and global events, and in-depth coverage of issues impacting our community. Tune in every weekday at 6:30 a.m., 12 noon, 2 p.m., and 6 p.m. for our major news bulletin in English, Igbo,
Country people, this not story time on top Echo
and Pidgin language. For more inquiries, you can reach us through our email, echofm@thekingmail.com. You can follow us on our social media handles at EchoFM. Echo FM 100.7 Owerri. We are the Fresh News People. It's the news at noon on Echo FM 100.7.
Good afternoon to you. This is Echo FM 100.7 Owerri, and this is the global news at noon. Echo FM is the station with fair and balanced reporting. My name is Mary Omeniwo, bringing you the latest news and breaking stories around the world. Here are the headlines. NSCDC threatens contractors with damage to Abuja fiber optic cables. U.S. warns citizens of fresh terror threats in Nigeria. Dangote refinery commits to energy stability amid global refinery shutdown. Missile attacks to continue, says Iran. And in the world of sports, Chelsea's Moroccan club rumors fake, according to NFF. We'll bring you details after this break. Stay tuned. We start off with this one that says the Nigeria Security and Civil Defense Corps, NSCDC, has threatened to prosecute construction firms and contractors responsible for damaging underground fiber optic cables in the Federal Capital Territory, FCT. The Corps warned that the continued destruction of the critical communication infrastructure poses serious risks to national security and economic stability. The FCT commandant of the NSCDC, Olushola Odumosu, issued the warning in Abuja following a surge in incidents where excavation works by contractors and developers severed vital communication cables across the capital. He stressed that the fiber optic installations are now legally recognized as strategic national assets under the designation and protection of Critical National Information Infrastructure Order of 2024. The commandant directed all contractors and developers carrying out construction or excavation projects in the FCT to verify the presence of underground installations before commencing work. He therefore advised them to liaise with telecommunication companies, relevant government agencies, and the NSCDC before undertaking excavation activities. Meanwhile, the United States Embassy in Nigeria has warned of a possible terrorist threat following targeting U.S. facilities and U.S.-affiliated schools in the country. In a security notice issued via its website, the embassy said the alert was intended to inform American citizens in Nigeria of potential risk and advised them to take additional precautions when visiting U.S. diplomatic missions and affiliated institutions. The notice asked U.S. citizens to exercise increased vigilance when traveling to its offices in Abuja and Lagos, as well as schools affiliated with the United States. The embassy also advised American nationals to vary their travel times and routes, avoid predictable routines, and ensure their mobile phones are charged in case of emergencies. The warning in Nigeria also comes amid a global security warning by the United States after Washington and Israel attacked Iran, which has responded with missiles and drone attacks against its U.S.-aligned neighbors. It also follows protests in Lagos and some northern states by members of the leadership of the Islamic movement who denounced the killing of Iran's supreme leader Ayatollah Ali Khamenei in strikes by the United States and Israel. And over to Lagos, where the Commissioner of Police, Lagos State Command, Oluhundare Jimo, has directed officials screening constable applicants to uphold transparency, fairness, and integrity throughout the exercise. Jimo made the call in a statement issued by the command spokesperson, SP Abimbola Adebisi. The commissioner gave the directive during a meeting with officials handling the credentials and physical screening of successful applicants from Lagos State. Earlier, the screening team, comprising police officers and personnel of the Police Service Commission, paid a courtesy visit to the CP at the command headquarters in Abuja. Jimo stressed that the exercise must strictly follow approved guidelines and the core values guiding the recruitment process. He noted that conducting the exercise with credibility will protect the integrity of the Police Service Commission, the Nigerian Police Force, and the country. And over to security matters, troops of Joint Task Force Operation Wellstroke have neutralized 2 suspected terrorists and recovered weapons, ammunition, and other items during an operation at Se Anka community in Yoho Council Ward of Katsina Ala local government area of Benue State. The operation was carried out on March 9, 2026 during a confidence-building patrol aimed at reassuring residents and denying criminal elements freedom of action in the area. In a statement released, signed by the acting media officer, Headquarters JTF Operation Wellstroke, Lieutenant Ahmed Zubairu. Zubairu said the troops acted on credible intelligence about the activities of suspected terrorists operating within the Se Anka community. The statement also stated that troops swiftly mobilized to the location in conjunction with operatives of the Benue State Civil Protection Guard to confront the threat head-on. It's exactly 8 minutes past noon. If you just joined us, you are listening to the Global News right here on Echo FM 100.7 Owerri. Here's a recap of the headlines. NSCDC threatens contractors with damage to Abuja fiber optic cables. U.S. warns citizens of fresh terror threats in Nigeria. Dangote refinery commits to energy stability amid global refinery shutdown. And on the foreign scene, missile attacks continue, says Iran. And on sports news, Chelsea Moroccan club rumors fake. This is according to the NFF. We'll bring you more details after this timeout. Please stay tuned.
Mpox is a rare disease caused by a virus that spreads through close contact with someone or an animal that's been infected with the disease. You can contract Mpox by being in contact with recently contaminated materials like clothing, bedding, and other items used by an infected person or animal. Symptoms of Mpox include chills, muscle aches, fever, headache, rash, and fatigue. In order to prevent yourself or your loved ones from coming down with Mpox, wash your hands regularly with soap and running water. Avoid contact with people who may be infected with the virus. Clean and disinfect surfaces thoroughly. Wear personal protective equipment when caring for people infected with the virus. If infected, remain in isolation until all lesions and scars fall off. This message is from Echo 100.7 FM, Owerri.
Welcome back. If you just joined us, you're listening to the Global News at noon right here on Echo FM 100.7. We'll now move over to the rest of the news. In business news, Dangote Petroleum Refinery and Petrochemicals has indicated its commitment to stabilizing energy supply to Nigeria amid recent shocks in the international oil market. The ongoing conflict in the Middle East has led to the shutdown of some refineries and cuts in refinery production across the world, resulting in a global scarcity of petroleum products. In addition, China has banned the export of gasoline and diesel. However, Dangote Refinery stated that Nigeria is insulated from these supply shocks because it is prioritizing supply to the domestic market, noting that this represents one of the key benefits of domestic refining. According to the company, the conflict has driven global crude oil and freight prices sharply higher, with benchmark Brent prices rising by about 26% within a short period to over $84 per barrel. The refinery further disclosed that while it receives about 5 cargoes of crude oil per month from the Nigerian National Petroleum Company Limited, NNPCL, which it pays in Naira, the volume is significantly below the 13 cargoes required monthly to meet domestic demands. It also explained that the cargoes supplied by NNPCL are also priced at international market rates plus a premium. Over now to the foreign scene, where the United States has announced plans to place the Sudanese Muslim Brotherhood under terrorism sanctions, with the designation expected to take effect later this month. The plan was disclosed in a press statement by the United States Department of State, signed by the U.S. Secretary of State, Marco Rubio. He alleged that the group had been involved in violence against civilians amid the ongoing conflict in Sudan. Rubio also noted that the group's Al-Bara bin Malik Brigade had previously been sanctioned. However, the U.S. Secretary of State further accused the Islamic Revolutionary Guard Corps of supporting extremist activities. According to the statement, the action was taken pursuant to Section 219 of the U.S. Immigration and Nationality Act and Executive Order 13224, which empowers the government to designate and sanction terrorist organizations. Still on the foreign scene, Iran's foreign minister has stated that talks with the United States was not on the agenda as their war entered its 11th day. On February 28, the U.S. and Israel launched strikes against Iran that killed its supreme leader, Ayatollah Ali Khamenei, and triggered a war that has spread across the Middle East. The Israeli and U.S. attacks took place 2 days before Washington and Tehran were scheduled to hold talks following 3 prior rounds of negotiations. Omani mediators in those discussions have said there was significant progress in the talks. Meanwhile, Iran has responded to the U.S.-Israeli attacks with drone and missile strikes targeting Israel and U.S. interests across the region. Iranian forces have also repeatedly targeted oil tankers passing through the strategic waterway since the war began. And lastly, in the world of sports this afternoon, the media officer of the Super Eagles, Promise Efoge, has dismissed reports linking head coach Chile with Moroccan club Wydad AC. A report surfaced in the media on Monday linking the Super Eagles coach with the club. The report, however, claimed that Chile could replace Amine Benhachem despite Wydad's victory over Union Tugad at the weekend. However, Efoge was quick to dismiss the report, describing it as fake news. The Super Eagles official X account also shared photos of the coach to reinforce Efoge's statement. It is the third time the Franco-Malian coach has been linked with a club coaching job despite having 1 year left on his contract with Nigeria Football Federation. Meanwhile, the president of the Nigerian Football Federation, NFF, Ibrahim Gusau, had also dismissed claims that Chile could be lured away by other African teams. Amid the ongoing speculation, Chile was also said to have tabled 19 demands before the MFF for contract renewal, including an increase in his monthly salary from $50,000 to $130, which would also cover his assistants. And that's all for the global news this afternoon. This was edited by Benjamin Joseph. For more information and inquiries, please visit our social media platforms on Facebook at Echo FM, X at Echo FM_Owerri, Instagram at Echo FM 100.7, and YouTube at Echo FM 100.7. You can listen to us anywhere in the world by clicking on www.echofm.net, that is www.echofm.net. My name is Mary Omeniwode. Thank you for listening and do have yourselves a lovely afternoon. In a few minutes, we'll be making a birthday call. Please do not miss that one. It promises to be fun. Stay tuned.
Echo FM.